Hi there, thanks. Yeah, thanks for having me here. So I'm the Deputy Chief Medical Health Officer for Vancouver Coastal Health. The overdose emergency is one of the main public health issues that I've traditionally worked on, and in the context of this COVID pandemic, essentially all of our public health resources were directed towards the pandemic. And now as we sort of emerge from the first wave, we are really seeing some of the harms that that has caused. Um, I think reflecting back on it, this really reveals to us that we've really done nothing to address the root cause of the overdose emergency, which is, of course, the toxic, unregulated drug supply. And the drug supply remains just as unregulated as it was when we declared the the emergency around overdose. And what we're seeing now with the drug supply shouldn't be unexpected to us. There probably are factors that have been caused by the pandemic, closure of the borders and, change of manufacturer from abroad to local, and, maybe less, people are maybe less familiar with how to make fentanyl locally, and that's why we're seeing higher concentrations of fentanyl. We've also had this trend of seeing increasing benzodiazepines contaminating opioid samples. And so, the drug supply is toxic right now, but it's been toxic the whole time. And I think that's what's been so dangerous about the drug supply. It's been toxic and it's variable and completely unpredictable. And so it's acting that way right now. So we shouldn't be surprised, I guess. But I think we had developed some interventions that were helping to prevent deaths, and we've had trouble both delivering those interventions and also having people come and use those interventions during the pandemic. And I'm talking about overdose prevention sites and supervised consumption sites. Um, these have been incredibly effective interventions to keep people alive. And in our region, we operate about 10 overdose prevention sites and 3 supervised consumption sites, and we supervise about 10,000 consumption events every week, typically. But during the pandemic, we're seeing about half of those visits. So wherever those other visits are happening, hopefully they're happening with somebody else present. Hopefully that person has an naloxone kit. Hopefully, um, something is happening to keep people safe, but it's not as safe as those supervised settings where nobody ever dies of an overdose. And so that's been a real challenge for us in the initial days of the lockdown. Many of those sites closed down, and we worked really quickly to get them open. We had to do a lot of infection prevention and control training because the sites hadn't really had that before. And we did manage to get them open, and now all of the sites are open. In fact, they were open within weeks of the lockdown, but the clients have not really come back in the same degree. Like everybody else in the world, they're afraid of getting COVID, um, and, uh, and they just haven't returned to the services. So we hope that we can, we're trying to change the services, move some of them outside to bigger environments so that people will feel more comfortable. But we really need to get people back to those supervised spaces. We also saw much fewer people coming to emergency rooms for overdose, despite the deaths going up. We saw much fewer people coming to emergency rooms for any reason during the pandemic. People were afraid of getting COVID at emergency rooms, and so they weren't coming. And so for that reason, we think they weren't also not calling 911. We think people were also less likely to observe overdoses during the pandemic because nobody was on the street. And even if people did observe overdoses during the pandemic, they were less likely to help people because for fear of getting COVID from the victim. And so we think that's played a big role. We're also concerned about the policies that Angel talked about. We've always been concerned about the restrictive guest policies and supportive housing, and those policies became even more restrictive during the pandemic. And so, how can you use drugs with somebody else if you can't bring people into your room to do that? And so we've been concerned about that as well. And so we have been able to make, I guess, a little bit of progress towards safe supply. It's hard even to describe it that way because it is such a tiny step, but the government did allow us to push through these risk mitigation guidelines that allowed prescribing of some pharmaceutical alternatives to street drugs to people during the pandemic so that they wouldn't have to leave their homes or come out of isolation in order to get street drugs. But of course, the alternatives are not really acceptable. And although some people are using them and we think it is probably helping people, it's just, too little too late, and not enough. So, and then in terms of the response and what was different, whenever we try to do anything around the overdose emergency, all we face is barriers. So we propose, loosening restrictions around OAT. We propose expanding IOAT. We try to find different sites to deliver tablet injectable opiate agonist therapy programs. We start giving opiate agonist therapy or injectable opiate agonist therapy at Insight, and we try to establish safe supply programs, but we just run into barriers from the different regulatory colleges, from the government, from all kinds of things. And that's the main work of working on the overdose, is trying to overcome those massive barriers. But in the case of pandemic, those barriers were not really present. And in fact, most of the government and the public was willing to do more than was actually necessary to control the virus. And we all spent a lot of our time trying to pull back what people were doing, for instance, closing facilities that we thought never needed to be closed, or closing public bathrooms, or doing things like that that we thought would cause more risk, but that people wanted to do more. And I think the reason really is because they felt that the virus could affect them personally, and they feel that to a lesser degree with the overdose crisis. And I think that's really too bad. So yeah, maybe I'll end there.